Phlebotomy Certification Exam Practice Test 2026 with answers. Question 1. What is the proper location for a capillary puncture on an infant's foot? Option A. The center of the plantar surface near the arch. Option B. The medial or lateral borders of the plantar surface of the heel. Option C. The tip of the great toe. Option D. The posterior curvature of the heel bone. The correct answer is option B. The medial or lateral borders of the plantar surface of the heel. Infant heel punctures are performed on the medial or lateral borders of the plantar heel. These areas avoid the calcaneus and reduce the chance of bone injury. The arch, great toe, and posterior heel are unsafe sites for routine infant skin puncture. Question 2. Which of the following factors is a major cause of specimen rejection in the laboratory? Option A. Collecting a lavender top tube for a CBC test. Option B. Submitting an underfilled light blue coagulation tube. Option C. Delivering a chemistry specimen to the lab within 4 to 5 minutes. Option D. Affixing a handwritten label over a pre-printed barcode label. The correct answer is option B. Submitting an underfilled light blue coagulation tube. Underfilled light blue coagulation tubes are a common cause of specimen rejection because the blood-to-citrate ratio is invalid. Excess citrate can alter clotting times and make results unreliable. Proper tube fill is more critical for citrate tubes than for many serum or EDTA tubes. Question 3. What is the appropriate antiseptic choice for blood culture site preparation in patients older than 2 months? Option A. 70% isopropyl alcohol alone. Option B. Chlorhexidine gluconate or tincture of iodine. Option C. Sterile saline solution. Option D. Benzalkonium chloride. The correct answer is option B. Chlorhexidine gluconate or tincture of iodine. Blood culture site preparation must strongly reduce skin flora to prevent false positive cultures. Chlorhexidine gluconate or tincture of iodine is commonly used for patients older than 2 months, depending on policy. Alcohol alone is not sufficient for many culture protocols, and saline is not an antiseptic. Question 4. What type of specimen is required for a plasma hemoglobin test? Option A. Serum separator tube, SST. Option B. Plain red top tube. Option C. Heparinized or EDTA plasma free of hemolysis. Option D. Whole blood collected in a grey top tube. The correct answer is option C. Heparinized or EDTA plasma free of hemolysis. Plasma hemoglobin testing requires plasma that is not contaminated by hemolysis from collection trauma. Heparinized or EDTA plasma is used because anticoagulated blood can be centrifuged to separate plasma. Serum or visibly hemolyzed specimens can falsely affect the measurement. Question 5. What is the function of the thixotropic gel inside an SST or PSD tube? Option A. To accelerate the coagulation cascade. Option B. To form a physical barrier between cells and serum/plasma during centrifugation. Option C. To preserve glucose levels for up to 24 hours. Option D. To chelate calcium and prevent fibrin formation. The correct answer is option B. To form a physical barrier between cells and serum/plasma during centrifugation. Thixotropic gel moves during centrifugation to create a stable barrier between the cells and the serum or plasma. This separation limits ongoing cellular metabolism and analyte exchange after spinning. The gel does not act as the anticoagulant or the clot activator. Question 6. Which of the following elements must be matched precisely between a patient's requisition sheet and their wristband? Option A. Patient's first name, last name, and unique medical record number. Option B. Patient's room number and name of their primary insurance carrier. Option C. Name of the ordering physician and the date the patient was admitted. Option D. Patient's diagnosis code and home phone number. The correct answer is option A. Patient's first name, last name, and unique medical record number. The requisition and wristband must match the patient's name and unique medical record number or equivalent identifier. Matching these identifiers confirms that the order belongs to the patient being drawn. Insurance, diagnosis, and physician information do not establish patient identity at the bedside. Question 7. Which of the following is a characteristic of arterial punctures that differentiates them from venipunctures? Option A. The blood is typically dark red or maroon. Option B. The blood will pulse spontaneously into the syringe. Option C. A tourniquet must be applied extremely tight. Option D. The angle of needle insertion is 15 degrees. The correct answer is option B. The blood will pulse spontaneously into the syringe. Arterial blood is under higher pressure and may pulse into the syringe without vacuum assistance. It is usually brighter red because it is more oxygenated. Venous blood typically flows more steadily and is collected at a shallower angle. Question 8. What should a phlebotomist do if they note a discrepancy between the patient's verbal name and the name on the pre-printed lab requisition? Option A. Change the requisition manually using a pen to match the verbal statement. Option B. Contact the supervisor or ordering nurse to resolve the issue before drawing blood. Option C. Draw the blood and sort out the labeling discrepancy later in the lab. Option D. Assume the patient knows their own name and print a new label on the spot. The correct answer is option B. Contact the supervisor or ordering nurse to resolve the issue before drawing blood. Any mismatch between the patient's statement and the requisition must be resolved before collection. Proceeding with unresolved identity information can create a wrong patient specimen and unsafe results. The phlebotomist should involve the supervisor, nurse, or ordering provider according to policy. Question 9. When using a butterfly winged infusion set with a light blue top tube, why must a discard tube be drawn first? Option A. To clear any residual skin surface contaminants from the needle. Option B. To purge the air out of the butterfly tubing to ensure a proper fill volume. Option C. To activate the coagulation cascade prior to sample collection. Option D. To check if the vein has adequate pressure to fill a full tube. The correct answer is option B. To purge the air out of the butterfly tubing to ensure a proper fill volume. Butterfly tubing contains air that can reduce the fill volume of the first tube collected. A discard tube removes that air so a light blue citrate tube fills to the required level. The discard is not collected to clean the needle or activate clotting. Question 10. Which of the following tubes should be collected first when performing a venipuncture draw using a multisample needle? Option A. Light blue top, sodium citrate. Option B. Blood culture bottles or yellow SPS tube. Option C. Red top, serum. Option D. Green top, heparin. The correct answer is option B. Blood culture bottles or yellow SPS tube. Blood culture bottles or yellow SPS tubes are collected first in a multisample draw. This protects the culture from additive carryover and supports sterile organism recovery. Coagulation and other additive tubes follow in the established order of draw. Question 11. Which of the following elements is critical to include on a manual handwritten specimen tube label? Option A. Phlebotomist's initials, patient's full name, DOB, date, and time of collection. Option B. Patient's insurance policy number and diagnosis code. Option C. Phlebotomist's full signature and room number. Option D. Name of the ordering physician and laboratory phone number. The correct answer is option A. Phlebotomist's initials, patient's full name, DOB, date, and time of collection. A manual tube label must clearly identify the patient, the collector, and the collection timing. Full name, date of birth or other unique identifier, date, time, and phlebotomist initials support traceability. Insurance data, diagnosis codes, and physician phone numbers do not replace specimen identifiers. Question 12. What clinical condition is characterized by a high accumulation of bilirubin in the blood, causing a yellowing of the skin and sclera? Option A. Cyanosis. Option B. Jaundice, icterus. Option C. Erythema. Option D. Pallor. The correct answer is option B. Jaundice, icterus. Jaundice, also called icterus, results from elevated bilirubin levels in blood and tissues. It causes yellow discoloration of the skin and sclera. Cyanosis, erythema, and pallor describe blue, red, and pale color changes from different causes. Question 13. Which of the following tests is part of a routine liver function panel? Option A. Creatinine. Option B, alanine aminotransferase, ALT. Option C, hemoglobin A1c. Option D, troponin I. The correct answer is option B, alanine aminotransferase, ALT. ALT is a liver-associated enzyme included in routine liver function evaluation. It helps assess hepatocellular injury when interpreted with other liver markers. Creatinine, HbA1c, and troponin are associated with kidney function, glucose control, and cardiac injury rather than a standard liver panel. Question 14. If a phlebotomist notes that a patient has an active hematoma in the right antecubital area, where should they draw blood? Option A, distal to, below, the hematoma in the right arm, or use the left arm. Option B, directly through the center of the active hematoma swelling. Option C, proximal to, above, the hematoma on the upper right arm. Option D, from the foot on the same side as the hematoma. The correct answer is option A, distal to, below, the hematoma in the right arm, or use the left arm. An active hematoma contains pooled blood outside the vessel and should not be punctured. The opposite arm is preferred, or a site distal to the hematoma may be used if appropriate and permitted. Drawing through the swelling can contaminate the sample and worsen bruising. Question 15. What is the liquid portion of an anticoagulated, centrifuged blood specimen called? Option A, serum. Option B, plasma. Option C, whole blood. Option D, fibrin clot. The correct answer is option B, plasma. Plasma is the liquid portion of anticoagulated blood after centrifugation. It contains clotting factors because clot formation has been prevented. Serum comes from clotted blood and lacks fibrinogen and many clotting factors. Question 16. What is the primary function of leukocytes? Option A, carrying oxygen to body tissues. Option B, preventing blood loss through clotting. Option C, defending the body against foreign pathogens. Option D, maintaining osmotic pressure in the plasma. The correct answer is option C, defending the body against foreign pathogens. Leukocytes are white blood cells that defend against infection and foreign material. They include several cell types involved in immune response, inflammation, and pathogen destruction. Red cells transport oxygen, platelets support clotting, and plasma proteins help maintain fluid balance. Question 17. Which of the following tests requires a fasting specimen to ensure diagnostic accuracy? Option A, complete blood count, CBC. Option B, lipid panel and fasting blood sugar. Option C, blood culture series. Option D, prothrombin time, patient. The correct answer is option B, lipid panel and fasting blood sugar. Lipid panels and fasting blood sugar tests are strongly affected by recent food intake. Fasting helps standardize triglyceride and glucose measurements for diagnostic interpretation. CBC, blood cultures, and patient usually do not require fasting for accuracy. Question 18. Which of the following can lead to a rejected specimen due to short draw? Option A, inverting a lavender tube 8 times. Option B, underfilling a light blue coagulation tube. Option C, using a 21 gauge needle on a large vein. Option D, drawing a serum separator tube before a green tube. The correct answer is option B, underfilling a light blue coagulation tube. A short draw in a light blue tube leaves too much citrate for the amount of blood collected. That imbalance can invalidate patient, INR, APTT, and other coagulation studies. Gentle inversion of a properly filled tube is expected and does not cause rejection. Question 19. Which of the following actions can lead to a false elevation in a patient's serum potassium level? Option A, releasing the tourniquet within 1 minute of needle insertion. Option B, keeping the patient's arm down during the venipuncture procedure. Option C, allowing the patient to pump their fist repeatedly before and during the draw. Option D, transporting the specimen to the laboratory within 30 minutes. The correct answer is option C, allowing the patient to pump their fist repeatedly before and during the draw. Repeated fist pumping can falsely elevate serum potassium by promoting local muscle activity and hemoconcentration. Potassium may shift out of cells or become concentrated in the specimen. A relaxed fist without pumping is preferred during routine venipuncture. Question 20. What is the function of platelets, thrombocytes, in the human body? Option A, transporting carbon dioxide back to the pulmonary system. Option B, producing specific antibody proteins to neutralize viral particles. Option C, participating in primary hemostasis by aggregating to form a platelet plug. Option D, maintaining systemic core body temperature variations. The correct answer is option C, participating in primary hemostasis by aggregating to form a platelet plug. Platelets support primary hemostasis by adhering to damaged vessel surfaces and aggregating into a platelet plug. They also provide a surface for coagulation reactions that stabilize clot formation. Red cells carry gases, and leukocytes provide immune defense. Question 21. Which tube is typically utilized to collect samples for blood bank cross-matching and typing? Option A, pink top, EDTA, or plain red top. Option B, light blue top, sodium citrate. Option C, gray top, sodium fluoride. Option D, green top, sodium heparin. The correct answer is option A, pink top, EDTA, or plain red top. Blood bank typing and cross-matching commonly use EDTA pink top tubes or plain red top tubes depending on facility requirements. EDTA preserves red cell antigens and prevents clotting for many immunohematology procedures. Citrate, fluoride, and heparin tubes are used for other testing categories. Question 22. If a patient is receiving an intravenous 4 infusion in the right arm, where should the phlebotomist attempt to draw blood? Option A, directly from the foreline itself. Option B, from the left arm. Option C, above the foresight on the right arm. Option D, from the hand on the right arm. The correct answer is option B, from the left arm. Drawing from the opposite arm avoids dilution or contamination from the fore infusion. For fluids, medications, and additives can alter test results if sampled from the same side. Drawing directly from the line or above the infusion site requires special authorization and is not routine phlebotomy practice. Question 23. When performing a newborn screening, PKU, collection card, how must the blood be applied to the filter paper? Option A, layered drop upon drop until the circle is saturated. Option B, applied to both sides of the paper simultaneously. Option C, brought into direct contact with a single large drop to fill the circle completely. Option D, smeared across the surface using a plastic capillary tube. The correct answer is option C, brought into direct contact with a single large drop to fill the circle completely. Newborn screening filter paper should be filled by touching the paper to a large hanging drop of blood until the circle saturates. The blood should soak through evenly from one side without layering multiple drops. Smearing, scraping, or applying blood to both sides can invalidate the specimen. Question 24. Which of the following statements matches the correct definition of assault? Option A, unjustified or unconsented physical contact with another person. Option B, the intentional threat or attempt to cause bodily harm, creating fear in the patient. Option C, revealing confidential medical findings to unauthorized personnel. Option D, mislabeling a laboratory specimen tube by accident. The correct answer is option B, the intentional threat or attempt to cause bodily harm, creating fear in the patient. Assault is an intentional threat or attempt that makes a patient fear harmful contact. No physical touching is required for assault to occur. Battery involves unauthorized touching, and confidentiality breaches involve private information rather than threatened harm. Question 25. Which of the following factors can cause a specimen to become hemolyzed during processing? Option A, allowing a serum separator tube to clot completely before centrifugation. Option B, balancing the centrifuge correctly with tubes of equal volume. Option C, centrifuging a specimen before it has completely clotted or spinning at an excessively high RPM. Option D, keeping a plasma specimen chilled on an ice slurry. The correct answer is option C, centrifuging a specimen before it has completely clotted or spinning at an excessively high RPM. Centrifuging a specimen before it clots completely or spinning too aggressively can rupture cells. This processing-related hemolysis can make serum or plasma red and alter analytes. Proper clot time and centrifuge settings help prevent specimen damage. Question 26. What is the modern medical term for a condition characterized by an abnormally low white blood cell count? Option A leukocytosis. Option B leukoponia. Option C thrombocytopenia. Option D polycythemia. The correct answer is option B, leukoponia. Leukoponia means an abnormally low white blood cell count. It may indicate myelosuppression, infection effects, medication effects, or immune compromise depending on context. Leukocytosis is high white blood cells, while thrombocytopenia and polycythemia refer to platelets and red cell mass. Question 27. Why is it essential to allow the 70% isopropyl alcohol to dry completely on the skin before puncturing? Option A. To prevent the alcohol from evaporating too fast. Option B. To avoid hemolysis of the specimen and a stinging sensation for the patient. Option C. To ensure the vein does not roll during insertion. Option D. To maximize the chemical interaction with the tube additive. The correct answer is option B. To avoid hemolysis of the specimen and a stinging sensation for the patient. Alcohol must dry completely so it can disinfect effectively and avoid being carried into the puncture site. Wet alcohol can sting and may contribute to hemolysis or specimen contamination. Blowing on or fanning the site can recontaminate the area and should be avoided. Question 28. For which of the following tests must the specimen be protected from light immediately after collection? Option A ammonia. Option B bilirubin. Option C lactic acid. Option D prothrombin. The correct answer is option B, bilirubin. Bilirubin is light sensitive and can degrade when exposed to room light or sunlight. Protecting the tube promptly helps prevent falsely decreased bilirubin values. Ammonia and lactic acid have temperature requirements, while coagulation testing has fill and timing requirements. Question 29. What type of consent is required before a phlebotomist can draw blood from a minor child? Option A. Implied consent from the child's teacher. Option B. Informed or expressed consent from a parent or legally authorized guardian. Option C. No consent is needed as long as a doctor ordered the test. Option D. Verbal consent from the minor patient themselves. The correct answer is option B. Informed or expressed consent from a parent or legally authorized guardian. A minor generally requires consent from a parent or legally authorized guardian before routine blood collection. The child should still receive age-appropriate explanation and cooperation should be sought when possible. A physician order alone does not eliminate consent requirements. Question 30. Which of the following is an example of an implied consent scenario? Option A. A patient signs a formal document for an invasive procedure. Option B. An unconscious emergency room patient requiring urgent diagnostic lab work. Option C. A patient verbally states they agree to the blood test. Option D. A parent signs a waiver for their underage child. The correct answer is option B. An unconscious emergency room patient requiring urgent diagnostic lab work. In an emergency, an unconscious patient may be treated under implied consent when urgent diagnostic information is needed. The law generally recognizes that a reasonable person would consent to necessary care to prevent harm. This differs from a signed consent form or a routine verbal agreement. Question 31. What is the primary purpose of applying a tourniquet during a venipuncture procedure? Option A. To stop the arterial blood flow to the limb. Option B. To engorge the veins and make them more palpable. Option C. To anchor the vein and prevent it from rolling. Option D. To ensure the sterility of the puncture site. The correct answer is option B. To engorge the veins and make them more palpable. A tourniquet temporarily slows venous returns so veins become fuller, easier to see, and easier to palpate. It should not stop arterial flow or be tightened enough to injure the patient. Vein anchoring and skin antisepsis are separate steps with different purposes. Question 32. Which of the following statements is true regarding a multisample needle gauge? Option A. A 21 gauge needle has a larger opening than a 22 gauge needle. Option B. An 18 gauge needle is smaller than a 23 gauge needle. Option C. The larger the gauge number, the larger the needle lumen. Option D. All needles used in phlebotomy have the same internal diameter. The correct answer is option A. A 21-gauge needle has a larger opening than a 22-gauge needle. Needle gauge numbers work inversely: the higher the number, the smaller the lumen. A 21-gauge needle therefore has a larger opening than a 22-gauge needle. Assuming all phlebotomy needles are the same size can lead to poor device selection and hemolysis risk. Question 33. What type of fire extinguisher should be used on an electrical fire occurring in a laboratory centrifuge? Option A, Class A. Option B, Class B. Option C, Class C. Option D, Class D. The correct answer is option C, Class C. Class C extinguishers are used for energized electrical equipment. They are designed to suppress fire without conducting electricity back to the user. Water-based Class A extinguishers can be dangerous on electrical fires. Question 34. What is the function of sodium polyamphole sulfonate, SPS, inside a yellow-top blood culture tube? Option A. To inhibit the growth of bacteria. Option B. To preserve glucose levels for bacterial metabolism. Option C. To aid in bacterial recovery by inhibiting complement and phagocytosis. Option D. To lyse red blood cells to release intracellular pathogens. The correct answer is option C. To aid in bacterial recovery by inhibiting complement and phagocytosis. SPS helps blood culture recovery by inhibiting complement, phagocytosis, and some antimicrobial activity in the specimen. This supports survival of microorganisms until incubation and analysis. It is not intended to kill bacteria or preserve glucose for chemistry testing. Question 35. Which of the following options defines the proper site for an adult capillary puncture? Option A. The thumb or index finger of the dominant hand. Option B. The lateral or medial plantar surface of the heel. Option C. The palmar surface of the distal segment of the middle or ring finger. Option D. The side of the pinky finger near the cuticle. The correct answer is option C. The palmar surface of the distal segment of the middle or ring finger. Adult capillary puncture is performed on the palmar surface of the distal segment of the middle or ring finger. These sites provide good blood flow and avoid bone, tendons, and heavily used thumb or index finger surfaces. The pinky and areas near the nail bed are more prone to injury or poor flow. Question 36. What color top tube is used to collect specimens for lead testing? Option A. Tan or royal blue with EDTA. Option B. Light blue. Option C. Light green. Option D. Yellow. The correct answer is option A. Tan or royal blue with EDTA. Lead testing requires tubes certified to be low in trace metal contamination, commonly tan or royal blue with EDTA. Ordinary stoppers and additives can contaminate trace element specimens. Light blue, green, and yellow tubes are selected for different testing needs. Question 37. Why should a phlebotomist avoid drawing blood from a paralyzed arm? Option A. The veins are too large and prone to exploding. Option B. The lack of muscle movement leads to poor circulation and potential thrombosis. Option C. The patient cannot feel if a nerve is being struck by the needle. Option D. Paralyzed limbs do not contain white blood cells. The correct answer is option B. The lack of muscle movement leads to poor circulation and potential thrombosis. A paralyzed arm may have reduced circulation, impaired sensation, and increased risk of thrombosis or swelling. Specimens from that limb may not reflect normal circulating blood as reliably. Lack of pain sensation can also delay recognition of injury, but poor circulation is the main concern. Question 38. What is the primary reason for avoiding venipuncture on an arm with an active hematoma? Option A. The needle will cause the hematoma to spread to the opposite arm. Option B. The sample will be contaminated with hemolyzed, stagnant blood from outside the vein. Option C. The vacuum tubes will implode due to tissue density variations. Option D. It will cause immediate and permanent paralysis of the limb. The correct answer is option B. The sample will be contaminated with hemolyzed, stagnant blood from outside the vein. A hematoma contains pooled blood outside the vein that may be stagnant or hemolyzed. Drawing through or near it can contaminate the sample and worsen tissue injury. A different site, preferably the opposite arm, should be selected when possible. Question 39. Which of the following practices is an example of an engineering control to prevent blood-borne pathogen exposure? Option A. Wearing a face shield when opening specimen tubes. Option B. Utilizing a sharps container with a wide, drop-in opening and safety needle shields. Option C. Washing hands with antimicrobial soap for 20 seconds. Option D. Following a strict order of draw sequence. The correct answer is option B. Utilizing a sharps container with a wide, drop-in opening and safety needle shields. Sharps containers with safe openings and safety needle shields are engineering controls because they isolate or remove the hazard by design. These devices reduce needle stick risk during and after collection. Gloves and training are important but do not physically engineer the hazard away. Question 40. What should a phlebotomist do when a multisample vacuum tube fails to fill with blood during a draw? Option A. Gently advance or pull back the needle slightly to ensure it is in the lumen. Option B. Remove the needle completely and start over on the other arm. Option C. Leave the tube in place for 3 minutes to allow the vacuum to recover. Option D. Push the needle deeper at a 90-degree angle. The correct answer is option A. Gently advance or pull back the needle slightly to ensure it is in the lumen. A vacuum tube that fails to fill may indicate the needle bevel is against the vein wall or not fully in the lumen. A small adjustment forward or backward can restore flow without unnecessary reinsertion. Pushing deeply or waiting for the vacuum to recover can injure tissue and waste time. Question 41. Which of the following values represents a panic or critical laboratory value that must be reported immediately? Option A fasting glucose of 90 mg/dl. Option B. A potassium level of 2.1 mg/L. Option C. A total cholesterol level of 210 mg/dl. Option D. A white blood cell count of 7,500/mcl. The correct answer is option B. A potassium level of 2.1 mg/L. A potassium level of 2.1 mg/L is critically low and can cause dangerous cardiac rhythm disturbances. Critical values must be reported immediately according to facility policy. Normal glucose or white blood cell values do not require urgent panic notification. Question 42. What is the target population for a Guthrie card or newborn screening test panel? Option A. Geriatric outpatients in nursing homes. Option B. Infants up to a few days or weeks old. Option C. Pregnant women in their first trimester. Option D. Patients undergoing active chemotherapy treatments. The correct answer is option B. Infants up to a few days or weeks old. Guthrie cards and newborn screening panels are designed for infants shortly after birth. They screen for metabolic, endocrine, and genetic conditions that benefit from early detection. Adult, prenatal, or oncology testing uses different screening methods. Question 43. What is the standard ratio of blood to anticoagulant additive in a light blue coagulation tube? Option F 1:1. Option B 5:1, Option C 9:1, Option D 10:1. The correct answer is option C, 9:1. Light blue coagulation tubes require a 9:1 blood to sodium citrate ratio. This ratio preserves clotting factor measurement without over-anticoagulating the sample. Underfilling the tube changes the ratio and can falsely prolong clotting results. Question 44. A phlebotomist enters a room to draw blood from an inpatient but notices the patient does not have an identification band attached to their body. What is the proper course of action? Option A. Draw the blood anyway and ask the patient to state their name. Option B. Look for the ID band on the nightstand or 4-pole and scan it. Option C. Refuse to draw the blood until a nurse attaches a new ID band to the patient. Option D. Verify identity using the chart at the foot of the bed and complete the draw. The correct answer is option C. Refuse to draw the blood until a nurse attaches a new ID band to the patient. An inpatient must have an identification band attached to the body before routine collection. A band on a table, bed rail, or four-pole cannot prove the patient's identity. Nursing staff should replace or verify the band before the phlebotomist proceeds. Question 45. What is the definition of fomite in an infection control context? Option A. An insect that transmits a virus. Option B. An inanimate object capable of harboring and transmitting infectious agents. Option C. A chemical agent used to sanitize skin surfaces. Option D. A specific type of airborne droplet nucleus. The correct answer is option B. An inanimate object capable of harboring and transmitting infectious agents. A fomite is a non-living object that can carry infectious material from one person or surface to another. Examples include bed rails, equipment, pens, and contaminated trays. Vectors are living carriers, while antiseptics and airborne particles describe different infection control concepts. Question 46. What is the correct protocol for mixing an additive tube after filling? Option A. Shake it vigorously up and down 5 times. Option B. Roll it back and forth between your palms for 30 seconds. Option C. Invert it gently back and forth the recommended number of times. Option D. Let it sit completely still in a rack to mix naturally. The correct answer is option C. Invert it gently back and forth the recommended number of times. Additive tubes must be mixed by gentle inversion the number of times recommended for that tube. This ensures blood contacts the additive without causing mechanical cell damage. Shaking, rolling, or leaving the tube unmixed can lead to hemolysis or clot formation. Question 47. What is the correct order of draw when collecting a blood culture, a chemistry SSD, and a sodium citrate tube using a multisample needle system? Option A. BSST, light blue, blood culture. Option B. Blood culture, light blue, SST. Option C. Light blue, SST, blood culture. Option D. Blood culture, SST, light blue. The correct answer is option B. Blood culture, light blue, SST. Blood cultures are drawn first, followed by light blue citrate tubes and then serum tubes such as SST. This sequence protects culture sterility and reduces additive carryover into coagulation specimens. Drawing SST before citrate can introduce clot activator or gel-related contamination risk. Question 48. What is the primary medical reason for avoiding dermal punctures on the heel of an infant who has begun walking? Option A. The skin has developed calluses that block capillary action flow. Option B. The child's heel bone is too small to locate accurately. Option C. Walking stimulates tissue changes and calluses, and the puncture can cause deep tissue or nerve irritation. Option D. Walking diverts all white blood cells up toward the abdominal cavity. The correct answer is option C. Walking stimulates tissue changes and calluses, and the puncture can cause deep tissue or nerve irritation. Once an infant begins walking, heel tissue becomes thicker and more calloused and is more vulnerable to deep tissue irritation. Heel puncture at that stage can be painful and less reliable for capillary sampling. Finger puncture or another approved method is used according to age and policy. Question 49. Which of the following scenarios is considered a breach of the Health Insurance Portability and Accountability Act, HIPAA? Option A. Discussing a patient's laboratory results with the ordering physician. Option B. Discussing a patient's lab results with a colleague in the hospital cafeteria. Option C. Entering patient information into an encrypted laboratory information system. Option D. Sharing critical panic values with the nurse assigned to the patient. The correct answer is option B. Discussing a patient's lab results with a colleague in the hospital cafeteria. Discussing patient results in a public cafeteria exposes protected health information to unauthorized listeners. HIPAA permits sharing information for treatment with authorized team members, but only in appropriate settings. Casual conversations in public areas violate confidentiality even when the colleague works in healthcare. Question 50. What tube additive prevents clotting by binding or chelating calcium? Option A. Lithium heparin. Option B. DDTA. Option C. Sodium polyethylene sulfonate. Option D. Thrombin. The correct answer is option B. DDTA. EDTA prevents clotting by chelating calcium, a required cofactor in the coagulation cascade. This makes it especially useful for hematology testing where cells must remain unclotted. Heparin inhibits thrombin activity, SPS supports blood culture recovery, and thrombin promotes clotting rather than preventing it. Question 51. What is the most appropriate step to ensure compliance with quality control measures regarding point-of-care testing, POCT, instruments? Option A. Calibrating the machine once every year. Option B. Running control solutions at scheduled intervals according to facility protocol. Option C. Cleaning the display screen with water after every patient test. Option D. Trusting the automated self-check system without external verification. The correct answer is option B. Running control solutions at scheduled intervals according to facility protocol. Point-of-care testing requires routine quality control to confirm the instrument and reagents are performing properly. Running controls according to manufacturer and facility schedules helps detect problems before patient results are reported. Relying only on automated self-checks or annual calibration is not sufficient. Question 52. What is the primary purpose of the multisample needle's rubber sleeve? Option A. To cushion the patient's vein from sudden movements. Option B. To prevent blood from leaking into the tube holder adapter between tube changes. Option C. To keep the needle sharp until it enters the vein. Option D. To guide the needle into the exact center of the vacuum tube. The correct answer is option B. To prevent blood from leaking into the tube holder adapter between tube changes. The rubber sleeve on a multisample needle seals the back end of the needle between tube changes. This prevents blood from leaking into the holder and reduces exposure risk. It does not guide the needle into the vein or protect the vein from movement. Question 53. Which of the following is the correct order of draw for a dermal, capillary, puncture? Option A. Lavender, green, red. Option B. Red, green, lavender. Option C. Green, lavender, red. Option D. Light blue, lavender, green. The correct answer is option A. Lavender, green, red. Capillary collections prioritize EDTA specimens first because small skin puncture samples clot rapidly. Other additive tubes follow, and serum tubes are typically collected last because clotting is expected there. Using venipuncture order for capillary specimens can allow microclots to compromise hematology testing. Question 54. Which of the following elements is a primary link in the chain of infection? Option A. The source or reservoir of the pathogen. Option B. The cost of personal protective equipment. Option C. The layout of the outpatient laboratory facility. Option D. The brand of antiseptic wipes used to clean benches. The correct answer is option A. The source or reservoir of the pathogen. A reservoir is a primary link in the chain of infection because it is where a pathogen lives and multiplies. Breaking any link, including reservoir, exit route, transmission, entry route, or susceptible host, helps stop spread. Equipment cost or room layout may influence practice but is not a chain link. Question 55. What type of specimen is obtained when a blood sample collected in a heparinized tube is centrifuged? Option A. Serum. Option B. Plasma. Option C. Whole blood. Option D. Fibrin clot. The correct answer is option B. Plasma. Centrifuged blood collected in a heparin tube yields plasma because clotting was prevented. Plasma contains fibrinogen and other clotting factors. Serum requires the blood to clot before centrifugation. Question 56. A phlebotomist needs to collect a specimen for a complete blood count, CBC. Which color tube should be selected? Option A. Red. Option B. Green. Option C. Light blue. Option D. Lavender. The correct answer is option D. Lavender. CBC testing requires anticoagulated whole blood with preserved cellular morphology and accurate cell counts. Lavender tubes contain EDTA, which binds calcium and prevents clotting while maintaining blood cell detail. Serum, citrate, or heparin tubes can alter hematology results or create unsuitable specimens. Question 57. If a phlebotomist encounters an outpatient who is hyperventilating and trembling with severe anxiety before a draw, what should they do? Option A. Proceed immediately to get the draw over with quickly. Option B. Instruct the patient to take slow, deep breaths and offer reassurance. Option C. Reschedule the test for a different week. Option D. Administer a sedative if available in the room. The correct answer is option B. Instruct the patient to take slow, deep breaths and offer reassurance. Severe anxiety and hyperventilation should be addressed before attempting venipuncture. Calm reassurance and slow breathing can reduce the risk of syncope, movement, or panic during the draw. Proceeding quickly or administering medication is not appropriate for a phlebotomist. Question 58. What type of hazard is represented by the yellow quadrant of the NFPA 704 diamond? Option A. Health hazard. Option B. Flammability hazard. Option C. Instability or reactivity hazard. Option D. Specific or special hazard. The correct answer is option C. Instability or reactivity hazard. The yellow quadrant of the NFPA 704 diamond represents instability or reactivity. It warns how readily a material may react, decompose, or explode under certain conditions. Health, flammability, and special hazards are shown in the other quadrants. Question 59. What occurs when a phlebotomist shakes a blood collection tube vigorously instead of inverting it gently? Option A. Hemoconcentration of the plasma. Option B. Hemolysis of the red blood cells. Option C. Complete inhibition of clotting factors. Option D. Falsely elevated platelet counts. The correct answer is option B. Hemolysis of the red blood cells. Vigorous shaking mechanically damages red blood cells and can cause hemolysis. Additive tubes should be mixed by gentle inversions so the additive distributes without cell rupture. Shaking does not improve clotting control and can make the specimen unsuitable for testing. Question 60. Which of the following factors can cause a false decrease in a patient's serum glucose measurement? Option A. Separating the serum from the red blood cells within 30 minutes of collection. Option B. Leaving the uncentrifuged specimen tube at room temperature for over 2 hours, allowing cells to consume glucose via glycolysis. Option C. Transporting the specimen to the laboratory on an ice slurry. Option D. Utilizing a gray top tube containing sodium fluoride to collect the sample. The correct answer is option B. Leaving the uncentrifuged specimen tube at room temperature for over 2 hours, allowing cells to consume glucose via glycolysis. Glucose can fall falsely when an uncentrifuged specimen sits at room temperature because cells continue to metabolize glucose. This ongoing glycolysis lowers the measured concentration over time. Prompt separation or collection in a fluoride-containing tube helps prevent the decrease. Question 61. A specimen for a lactic acid test must be handled using which special accommodation? Option A. Placed immediately on an ice slurry. Option B. Incubated at 37 degrees Celsius until tested. Option C. Kept away from all light sources using foil. Option D. Centrifuged immediately within 5 minutes of draw. The correct answer is option A. Placed immediately on an ice slurry. Lactic acid specimens are commonly chilled promptly to slow cellular metabolism after collection. Continued glycolysis can change lactate concentration if handling is delayed. Light protection or warming is used for different analytes, not routine lactate preservation. Question 62. Which of the following values represents a normal fasting blood glucose level for a healthy adult? Option A. 70 to 99 mg/dl. Option B. 140 to 180 mg/dl. Option C. 200 to 250 mg/dl. Option D. 300 to 350 mg/dl. The correct answer is option A. 70 to 99 mg/dl. A normal fasting glucose for a healthy adult is generally about 70 to 99 mg/dl. Values above that range may suggest impaired fasting glucose or diabetes depending on diagnostic criteria and repeat testing. The higher ranges listed would be abnormal and require clinical follow-up. Question 63. What does the term basal state refer to in clinical laboratory testing? Option A. The condition of the body early in the morning, resting and fasting for roughly 12 hours. Option B. The physical state of the body directly following a heavy workout session. Option C. The point of highest metabolic activity in the afternoon. Option D. The body state while under heavy psychological stress. The correct answer is option A. The condition of the body early in the morning, resting and fasting for roughly 12 hours. Basal state refers to the body's resting condition after fasting, usually early in the morning. This state reduces the effects of recent meals, exercise, stress, and daily variation on laboratory values. Heavy activity or psychological stress can significantly alter some analytes. Question 64. If a phlebotomist notices a hematoma beginning to form during a blood draw, what action should be taken immediately? Option A. Adjust the depth of the needle to stop the swelling. Option B. Remove the tourniquet, withdraw the needle, and apply firm pressure. Option C. Advance the needle further to bypass the hematoma. Option D. Request the patient to pump their fist to redistribute the blood. The correct answer is option B. Remove the tourniquet, withdraw the needle, and apply firm pressure. A developing hematoma means blood is leaking into surrounding tissue, so collection should stop at once. Releasing the tourniquet, withdrawing the needle, and applying firm pressure limits bleeding and tissue damage. Advancing the needle or continuing the draw can enlarge the hematoma and increase patient injury. Question 65. For which of the following tests must a phlebotomist use a gray top tube containing potassium oxalate? Option A. Erythrocyte sedimentation rate, ESR. Option B. Oral glucose tolerance test, OGTT. Option C. Activated partial thromboplastin time, APTT. Option D. Blood urea nitrogen, BUN. The correct answer is option B. Oral glucose tolerance test, OGTT. Oral glucose tolerance testing uses gray tubes when glucose stability must be preserved over time. Sodium fluoride slows glycolysis, while potassium oxalate helps prevent clotting. Coagulation, chemistry, and hematology tubes do not provide the same glucose preservation. Question 66. What is the correct angle of insertion for a standard multisample needle during a venipuncture? Option A. 5 to 10 degrees. Option B. 15 to 30 degrees. Option C. 45 to 60 degrees. Option D. 90 degrees. The correct answer is option B. 15 to 30 degrees. A standard straight needle is usually inserted at a shallow 15 to 30 degree angle to enter the vein smoothly. This angle helps avoid passing through the vein or striking deeper structures. Very shallow angles can miss the lumen, while steep angles increase tissue trauma. Question 67. Which of the following practices is critical to perform when collecting a specimen for a cold agglutinin test? Option A. Keep the collection tube pre-warmed to 37 degrees Celsius before and during collection. Option B. Chill the tube in an ice slurry immediately after drawing. Option C. Protect the specimen from light by wrapping it in heavy foil. Option D. Centrifuge the tube immediately within 2 minutes of collection. The correct answer is option A. Keep the collection tube pre-warmed to 37 degrees Celsius before and during collection. Cold agglutinin specimens must be collected and kept warm at about 37 degrees Celsius. Cooling can cause antibody-mediated red cell agglutination before testing and distort results. Pre-warmed tubes and warm transport preserve the specimen condition needed by the laboratory. Question 68. When performing venipuncture, the needle should be inserted with the bevel facing in which direction? Option A. Facing downward. Option B. Facing upward. Option C. Facing to the left. Option D. Facing to the right. The correct answer is option B. Facing upward. The bevel should face upward so the sharpest edge enters the skin and vein smoothly. This orientation reduces tissue trauma and improves the likelihood of entering the venous lumen. Turning the bevel down or sideways can make insertion more painful and less controlled. Question 69. What does the term phlebotomy literally mean in Greek? Option A. To clear a blood clot. Option B. To measure blood cells. Option C. To cut into a vein. Option D. To study circulating fluids. The correct answer is option C, to cut into a vein. The word phlebotomy comes from roots meaning to cut into a vein. The term reflects the traditional act of opening a vein to obtain blood. Measuring cells, studying fluids, or removing clots describes different laboratory or clinical activities. Question 70. Which of the following veins is located on the medial, inner, aspect of the antecubital fossa and is close to the brachial artery? Option A, cephalic vein. Option B, basilic vein. Option C, median cubital vein. Option D, radial vein. The correct answer is option B, basilic vein. The basilic vein is located medially on the inner side of the antecubital area. It lies closer to the brachial artery and median nerve than the preferred veins. This anatomical relationship is why it is usually avoided unless necessary. Question 71. Which of the following elements can cause a falsely elevated calcium level during a venipuncture? Option A, prolonged tourniquet application past 2 minutes. Option B, chilling the specimen on an ice slurry. Option C, using a 21-gauge needle on a large vein. Option D, failing to wipe away the first drop of blood during a finger stick. The correct answer is option A, prolonged tourniquet application past 2 minutes. Prolonged tourniquet application can concentrate proteins and protein-bound analytes, including calcium. This may create falsely elevated calcium results. Chilling, normal needle size, or capillary first drop handling do not cause the same venous stasis effect. Question 72. What is the clinical name for the stoppage of bleeding from a damaged blood vessel? Option A, hemostasis. Option B, homeostasis. Option C, hemolysis. Option D, hemoconcentration. The correct answer is option A, hemostasis. Hemostasis is the process that stops bleeding after vessel injury. It involves vascular constriction, platelet plug formation, and coagulation. Homeostasis is broader internal balance, while hemolysis and hemoconcentration are specimen or blood changes. Question 73. Which gauge needle has the smallest lumen diameter? Option A, 18 gauge. Option B, 21 gauge. Option C, 23 gauge. Option D, 25 gauge. The correct answer is option D, 25 gauge. Needle gauge is inversely related to lumen size, so higher gauge numbers have smaller openings. A 25 gauge needle has the narrowest lumen among the listed sizes. Smaller lumens can increase hemolysis risk when used for routine venipuncture. Question 74. What is the standard duration for an administrative scrub or hand washing when preparing for routine patient contact? Option A, 5 seconds. Option B, 20 seconds. Option C, 1 minute. Option D, 3 minutes. The correct answer is option B, 20 seconds. Routine hand washing before patient contact should last at least 20 seconds. This duration allows adequate friction and contact time to remove transient microorganisms. Very brief washing is ineffective, while surgical scrub times are reserved for different procedures. Question 75. Which of the following additives is used in a blood culture bottle to neutralize antibiotics circulating in the patient's blood? Option A, resin or activated charcoal particles. Option B, sodium polyent whole sulfonate, SPS. Option C, acid citrate dextrose, ACD. Option D, thixotropic gel barrier. The correct answer is option A, resin or activated charcoal particles. Resin or activated charcoal in blood culture bottles can bind or neutralize antibiotics present in the patient's blood. This improves recovery of organisms when the patient has already received antimicrobial therapy. The additive does not replace sterile collection technique or proper bottle filling. Question 76. Which of the following items is the preferred antiseptic for cleaning a site prior to performing an arterial blood gas, ABG, draw? Option A, 70% isopropyl alcohol followed by chlorhexidine gluconate or povidone iodine. Option B, plain sterile water. Option C, diluted hydrogen peroxide solution. Option D, sodium hypochlorite spray. The correct answer is option A, 70% isopropyl alcohol followed by chlorhexidine gluconate or povidone iodine. Arterial puncture sites require strong antisepsis because the procedure is deeper and carries higher complication risk than routine venipuncture. Alcohol followed by chlorhexidine or povidone iodine is commonly used according to policy. Sterile water, peroxide, or bleach sprays are not appropriate skin antiseptics for ABG collection. Question 77. What does a trough level measure in therapeutic drug monitoring, TDM? Option A. The highest concentration of the drug in the patient's system. Option B. The lowest concentration of the drug, measured right before the next dose. Option C. The average concentration of the drug over a 24-hour window. Option D. The amount of drug excreted through the kidneys. The correct answer is option B. The lowest concentration of the drug, measured right before the next dose. A trough level measures the lowest drug concentration, usually just before the next scheduled dose. Timing is critical because the result guides dosing safety and therapeutic effectiveness. Peak levels measure the highest concentration after dosing and answer a different clinical question. Question 78. What type of glove material should be used if a patient or phlebotomist has a documented type I hypersensitivity allergic reaction? Option A. Powdered latex. Option B. Non-powdered latex. Option C. Nitrile or vinyl. Option D. Cotton utility gloves. The correct answer is option C. Nitrile or vinyl. Type I latex hypersensitivity can cause serious allergic reactions, so latex gloves should be avoided. Nitrile or vinyl gloves provide barrier protection without latex protein exposure. Cotton gloves do not provide adequate protection for blood collection. Question 79. What is the main clinical outcome of inadvertent arterial puncture during a venipuncture attempt? Option A. Rapid hematoma formation and bright red pulsing blood. Option B. Falsely decreased systemic blood pressure. Option C. Accelerated hemolysis within the vacuum collection tube. Option D. Immediate collapse of the surrounding capillary beds. The correct answer is option A. Rapid hematoma formation and bright red pulsing blood. Accidental arterial puncture often produces bright red, pulsating blood and can cause rapid hematoma formation. The needle should be removed and firm pressure applied because arterial pressure is higher than venous pressure. Treating it like a routine venous draw increases bleeding risk. Question 80. What represents the correct order for removing personal protective equipment, PPE, after a procedure? Option A. Gown, gloves, mask, goggles. Option B. Gloves, goggles, gown, mask. Option C. Mask, gown, goggles, gloves. Option D. Goggles, mask, gloves, gown. The correct answer is option B. Gloves, goggles, gown, mask. PPE is removed in a sequence that limits contamination of clean skin and clothing. Gloves are usually removed first because they are most contaminated, followed by eye protection, gown, and mask according to facility procedure. Removing the mask too early or touching the outside of contaminated PPE increases exposure risk. Question 81. What should a phlebotomist do if they accidentally touch the site after it has been cleansed with alcohol? Option A. Proceed with the venipuncture immediately before the site gets contaminated further. Option B. Blow on the skin surface to dry any skin oils that transferred. Option C. Re-cleanse the site completely with a fresh alcohol prep pad and allow it to dry. Option D. Wipe the needle tip with alcohol before inserting it into the skin. The correct answer is option C. Re-cleanse the site completely with a fresh alcohol prep pad and allow it to dry. Touching a cleaned puncture site recontaminates the skin and compromises antisepsis. The site should be cleansed again with a fresh prep pad and allowed to air dry. Wiping the needle or blowing on the skin does not restore a clean field. Question 82. Which organization regulates safety conditions in the workplace, including exposure to bloodborne pathogens? Option A. CDC. Option B. FDA. Option C. OSHA. Option D. CLSI. The correct answer is option C. OSHA. OSHA sets and enforces workplace safety requirements, including rules for bloodborne pathogen exposure. These standards address training, protective equipment, sharp safety, and exposure control plans. CDC and CLSI provide guidance, but OSHA is the regulatory enforcement agency for workplace safety. Question 83. Which of the following is a symptom of nerve injury during a venipuncture? Option A dull ache in the antecubital fossa. Option B, a sharp, radiating, electric-like pain down the arm. Option C, a sudden feeling of warmth at the puncture site. Option D, small red spots spreading around the arm. The correct answer is option B, a sharp, radiating, electric-like pain down the arm. Sharp, radiating, electric-like pain suggests contact with or irritation of a nerve. The venipuncture should be stopped immediately to prevent further injury. Dull discomfort, warmth, or petechiae do not signal nerve involvement in the same way. Question 84. What type of protective equipment must be worn when performing a venipuncture on a patient with droplet precautions? Option A, an N95 respirator mask and shoe covers. Option B, a standard surgical mask and gloves. Option C, a full body Tyvek suit and goggles. Option D, no personal protective equipment is required. The correct answer is option B, a standard surgical mask and gloves. Droplet precautions require a surgical mask, and gloves are used for venipuncture under standard precautions. The mask protects mucous membranes from large respiratory droplets during close contact. N95 respirators are reserved for airborne precautions. Question 85. What should a phlebotomist do if a patient experiences a sudden, sharp, shooting pain down their arm during a venipuncture? Option A, advance the needle deeper to see if the pain stops. Option B, terminate the venipuncture immediately, withdraw the needle, and assess for nerve injury. Option C, tell the patient that minor discomfort is completely normal for this vein. Option D, instruct the patient to keep their arm completely still while you finish filling the tube. The correct answer is option B, terminate the venipuncture immediately, withdraw the needle, and assess for nerve injury. Sudden sharp shooting pain down the arm suggests possible nerve contact. The venipuncture should be terminated immediately, the needle withdrawn, and the patient assessed according to policy. Continuing or redirecting the needle can worsen nerve injury. Question 86. What should a phlebotomist do if they encounter a patient who does not speak the same language as the healthcare provider? Option A, use hand gestures to explain the invasive procedure and proceed with the draw. Option B, enlist the services of a certified medical interpreter to ensure proper communication and consent. Option C, ask the patient's roommate to translate the instructions for you. Option D, cancel the test order and document the patient as uncooperative. The correct answer is option B, enlist the services of a certified medical interpreter to ensure proper communication and consent. Certified medical interpreters ensure that the patient receives accurate information and can provide meaningful consent. Family members or untrained staff may omit, alter, or misunderstand medical details. Clear communication is essential for safety, cooperation, and legal compliance. Question 87. Chain of custody protocols are required for which type of laboratory specimens? Option A, routine lipid panels. Option B, therapeutic drug monitoring. Option C, paternity and forensic drug testing. Option D, blood cultures for sepsis. The correct answer is option C, paternity and forensic drug testing. Chain of custody is required when the specimen may be used as legal evidence or to establish identity. Forensic drug testing and paternity testing require documentation of collection, handling, transfer, and receipt. Routine clinical tests do not usually require that level of legal tracking. Question 88. Which of the following blood components is responsible for the initiation of the coagulation process? Option A, erythrocytes. Option B, leukocytes. Option C, thrombocytes. Option D, hemoglobin. The correct answer is option C, thrombocytes. Thrombocytes, also called platelets, initiate primary hemostasis by adhering and aggregating at sites of vessel injury. They help form the initial platelet plug before the coagulation cascade stabilizes the clot. Red cells carry gases, and white cells primarily defend against infection. Question 89. Which of the following conditions is an example of an autoimmune or hematological test commonly drawn in a lavender tube? Option A, prothrombin time, patient. Option B, erythrocyte sedimentation rate, ESR. Option C, basic metabolic panel, BMP. Option D, blood culture series. The correct answer is option B, erythrocyte sedimentation rate, ESR. ESR is commonly collected in an EDTA tube because the test evaluates red cell settling in anticoagulated blood. Lavender tubes preserve cellular components and prevent clotting. Coagulation and chemistry tests require different tubes and additives. Question 90. Which of the following situations can cause a false elevation in a patient's serum ammonia level? Option A, transporting the specimen to the laboratory on ice. Option B, delaying the separation of cells from the plasma beyond 15 minutes at room temperature. Option C, using a green top tube containing sodium heparin. Option D, labeling the specimen tube at the patient's bedside. The correct answer is option B, delaying the separation of cells from the plasma beyond 15 minutes at room temperature. Ammonia can rise falsely when cells remain in contact with plasma at room temperature. Prompt chilling, rapid transport, and timely separation help preserve the true value. Delays beyond recommended handling times are a major pre-analytical source of error. Question 91. What should the phlebotomist do immediately before applying a bandage to a venipuncture site? Option A, check the site to confirm that active bleeding has completely stopped. Option B, ask the patient to bend their elbow firmly over the gauze pad. Option C, apply a generous layer of antibiotic ointment to the wound. Option D, label the tubes using the patient's bedside charts. The correct answer is option A, check the site to confirm that active bleeding has completely stopped. The puncture site must be checked to confirm bleeding has stopped before a bandage is applied. Bandaging over active bleeding can hide continued blood loss and increase bruising. Bending the elbow can also promote hematoma formation and should not be used as pressure technique. Question 92. Which department of the laboratory processes a comprehensive metabolic panel, CMP? Option A, hematology. Option B, microbiology. Option C, clinical chemistry. Option D, blood bank. The correct answer is option C, clinical chemistry. A comprehensive metabolic panel measures chemistry analytes such as electrolytes, glucose, kidney markers, proteins, and liver-associated enzymes. These tests are processed in clinical chemistry. Hematology, microbiology, and blood bank perform different categories of testing. Question 93. What is the correct protocol for an inpatient who is sleeping when the phlebotomist arrives to draw blood? Option A, draw the blood quietly without waking them up to minimize pain. Option B, gently wake the patient, identify them properly, and explain the procedure before proceeding. Option C, skip the patient and mark them as unavailable on the computer. Option D, ask the patient's roommate to confirm their identity for you. The correct answer is option B, gently wake the patient, identify them properly, and explain the procedure before proceeding. A sleeping inpatient must be awakened and identified before collection. The phlebotomist should explain the procedure and obtain cooperation when possible. Drawing quietly without waking the patient prevents proper identification and consent. Question 94. What should a phlebotomist do if they observe small, red spots appearing on a patient's skin after applying a tourniquet? Option A, remove the tourniquet immediately, as this indicates petechiae and potential bleeding issues. Option B, tighten the tourniquet further to stop the spots from spreading. Option C, ignore the spots, as they are a normal reaction to isopropyl alcohol. Option D, rub the skin surface firmly to see if the spots disappear. The correct answer is option A, remove the tourniquet immediately, as this indicates petechiae and potential bleeding issues. Petechiae after tourniquet application suggest fragile capillaries or a bleeding tendency. The tourniquet should be removed and the site reassessed before proceeding. Continuing pressure can worsen capillary bleeding and bruising. Question 95. Which of the following tubes contains an additive that preserves glucose levels for up to 3 days? Option A, gray top, sodium fluoride. Option B, light blue top. Option C, lavender top. Option D, green top. The correct answer is option A, gray top, sodium fluoride. Gray tubes containing sodium fluoride preserve glucose by inhibiting glycolysis for an extended period. This helps maintain glucose concentration when processing may be delayed. Other tube types do not provide the same glucose stabilizing additive. Question 96. Which of the following parameters is evaluated when performing a basic metabolic panel, BMP? Option A, hemoglobin and hematocrit levels. Option B, the electrolytes, blood urea nitrogen, creatinine, and glucose. Option C, coagulation factor levels and platelet function. Option D, bacterial growth over a 48-hour incubation period. The correct answer is option B, electrolytes, blood urea nitrogen, creatinine, and glucose. A basic metabolic panel evaluates electrolytes, glucose, blood urea nitrogen, creatinine, and related chemistry values. It is used to assess kidney function, acid-base status, and metabolic balance. Liver enzymes, cardiac markers, and hematology counts belong to other panels or departments. Question 97. What is the primary clinical consequence of warming an infant's heel prior to a dermal puncture? Option A, it decreases the pain perception of the infant. Option B, it increases localized arterial blood flow up to 7-fold. Option C, it sterilizes the deeper layers of the epidermis. Option D, it prevents the formation of an unneeded hematoma. The correct answer is option B. It increases localized arterial blood flow up to 7-fold. Warming an infant's heel increases local blood flow and improves capillary specimen collection. Better perfusion can reduce squeezing, which helps avoid tissue fluid contamination. Warming does not sterilize tissue or eliminate the need for proper puncture depth. Question 98. What is the correct site for performing a dermal puncture on an adult patient's finger? Option A, the exact center of the finger pad on the index finger. Option B, the fleshy, off-center side of the distal segment of the middle or ring finger. Option C, the side of the pinky finger close to the nail bed. Option D, the palmar crease of the thumb. The correct answer is option B, the fleshy, off-center side of the distal segment of the middle or ring finger. Adult finger puncture is performed on the fleshy, off-center side of the distal segment of the middle or ring finger. This location provides good capillary flow while avoiding bone and heavy nerve concentration. The center pad, thumb, index finger, pinky, and nail areas are less desirable. Question 99. Which of the following conditions describes a vein that feels hard, cord-like, and lacks resiliency? Option A, patent vein. Option B, sclerosed vein. Option C, superficial vein. Option D, tortuous vein. The correct answer is option B, sclerosed vein. A sclerosed vein feels hard, cord-like, and poorly resilient because of scarring or repeated irritation. Such veins may not accept a needle well and can yield poor flow. A patent vein is open and resilient, while tortuous veins are winding rather than necessarily hardened. Question 100. Which of the following parameters can cause a false elevation in a patient's white blood cell count? Option A, collecting the sample while the patient is crying intensely or under extreme stress. Option B, chilling the specimen on an ice slurry before transport. Option C, protecting the collection tube from direct artificial room lights. Option D, allowing the serum to sit on the cells for more than 2 hours. The correct answer is option A, collecting the sample while the patient is crying intensely or under extreme stress. Extreme stress, crying, or intense physical exertion can temporarily elevate the white blood cell count. Stress hormones can shift leukocytes into circulation and make the value appear higher. Specimen chilling or light protection does not produce this physiologic leukocytosis.